And then for the lithotripsy with removal of fragments, that's extirpation. That's going to be out of the bladder, so OTCB4ZZ. All right, the next section is all about the men. We have the male genital organs. So those code out to categories. It's your lucky night.
It is my lucky night.
To
Wow.
categories
I'm just gonna learn
N40
so
through
much.
N53. Okay. And of course, the first three have to do with the prostate, and that's where you'll be doing a lot of your coding. So N40 to N42. Again, we have the reminder that if it's a malignancy, you're going to be in Chapter 2, and they give you those codes there for malignant neoplasm of the prostate, benign, and in situ. Okay. But N40 then is for hyperplasia, so let's go look up N40. So of course this is going to be the enlarged prostate. And that's on page 798. Remember, with this category, the fourth digit is going to tell you with or without LUTS, which is lower urinary tract symptoms. Okay? And notice what it tells you there. Use an additional code to identify the symptoms. So your code is just saying hyperplasia of the prostate with symptoms. They want you to put on those additional codes to show urgency or obstruction or whatever's going on. Okay? And then N41, while you're there, that's all the inflammatory diseases. So that's all your prostatitis, acute, chronic, whatever, granulomatous, all the different types of inflammation of the prostate. And then N42 is other disorders of the prostate. So this could be a lot of things. They could have stones, they could have a cyst, they could have dysplasia, all sorts of things. Okay, so the three categories, hyperplasia or enlarged, and then prostatitis, inflammation, and then other. When they do a prostatectomy, you're going to have to find out if it is a complete prostatectomy or partial. Of course, if it's complete, you're going to be at the root operation resection. If it's partial, you're going to be at the root operation excision. And of course, then with these, you're also going to have to know the approach. So open, percutaneous endoscopy, via natural, all the choices. But there is some information they give you in here. Remember the other night when we coded the hysterectomy and we maybe forgot that we needed 2 codes? This is that same kind of information. So you may want to write it in your book somewhere or make yourself a note somehow. If they do a radical prostatectomy, they are not only removing the prostate, but they're also doing a bilateral seminal vesiculectomy. So they're taking out the seminal vesicles, bilateral, as well as the vas ampulla. And that requires 2 codes. One for a resection of the prostate, one for a resection of the bilateral seminal vesicles. Radical prostatectomy, 2 codes. If they do a radical cystectomy, which means they're taking out the urinary bladder, that surgery includes also the removal of the prostate and the removal of the bilateral seminal vesicles. So that's going to be 3 codes. Resection of the bladder, resection of the prostate, and resection of bilateral seminal vesicles. So I would make myself a note of those things somewhere. What's included? Okay. And then of course we can also do destruction of prostatic tissue. So if you see him talking about radiofrequency or thermotherapy or microwave thermotherapy, those are all going to code out to destruction. Questions about the prostate? Okay, endometriosis. You know what that is? Where you've got, oh yeah. Yeah, where you have tissue that's similar to uterine tissue, but it's implanted itself outside of the uterus. So you could have implants on the ovaries, you could have them on the colon, they could be anywhere. So endometriosis codes out to N80, and the fourth character shows the site of the implant. And then down at the bottom, genital prolapse. Here you have to know which organs are involved. So is it just the vaginal wall? Is it the uterus, or is it both? And then is the prolapse complete or incomplete? And basically you just follow your index. Kind of sounds like there's a lot to think about there, but you'll just see that it's, you know, prolapse, uterus, complete, incomplete. So you don't have to worry about it. Okay, on the next page, it talks about code N99.3, which is assigned for prolapse of the vaginal vault after hysterectomy. That is not considered a surgical complication. We might consider it that, but it is not considered a surgical complication. Okay. And then next, it talks about pelvic or vaginal enterocele. Remember what entero means? Intestines. So we have a herniation of the intestine through the vaginal mucosa. So a vaginal enterocele codes out to N81.5. And that doesn't matter if it's congenital or acquired. Which is kind of weird. We usually have a Q code for congenital. And shockingly, a prolapse of the uterus during pregnancy will reclassify to, the OB chapter. So you can see that though, see in the middle of those codes down there at the bottom, the 034.522, prolapse of a gravid uterus. You know, gravid means she's pregnant. So prolapse of a gravid uterus. Top of the page, endometrial hyperplasia. You know what that is? Anybody had that? Excessive growth of the lining of the uterus. Oftentimes it's related to precancerous or the development of cancer, endometrial cancer, so they want to catch that and watch it and do something about it. So you can see that's going to code out to N85 based on whether it's benign, malignant, or unspecified. And then the whole next section we've talked about numerous times. These are your SIN 1, 2, 3, your vein 1, 2, 3, and your VIN 1, 2, 3. So remember, SIN is for cervical dysplasia. 1 is going to be mild, 2 is going to be moderate, and 3 is severe. Vein is the same thing, only vaginal dysplasia. And VIN is the same thing, only vulva dysplasia. Okay, and what do we know about that? SIN 3, VIN 3, and vein 3 all code out to carcinoma in situ. Okay, but that, we can only know that from a pathological diagnosis. So you're going to have to see that on the path report. And then it gives you a couple of extra codes there for abnormal cytology findings based on whether the specimen is from the cervix uteri or the vagina. So R87.61 and R87.62, both of those are without histological confirmation.